A lot of women in my classes report being really freaked out when they go to the bathroom because they're afraid they're going to see blood when they wipe, which is a totally valid concern, especially in the first trimester when the chances of miscarriage are a bit higher. I know that I had a little bit of bleeding in the first trimester. It was right after sex. It's super common to have some bleeding after you have sex during pregnancy. I totally freaked out. I called my mom crying, and because we have no boundaries, I told her I just had sex and I'm bleeding and I'm probably miscarrying, and I was totally spinning out. She's an RN, so I thought like she'll know. And one of the first things that she said was, blood is not a definite sign of miscarriage. She's absolutely right. 22% of women bleed at some point during pregnancy. Some even have heavy bleeding and go on to have a very healthy, normal pregnancy, childbirth, a healthy baby. So no, blood is definitely not a 100% sign that you are miscarrying. It is common to have a bit of bleeding about 10 to 14 days after conception when the embryo is implanting itself in the uterus. It can also be common to have some bleeding when the cervix is going through its remodeling, which is an actual thing. So the cervix during really like the first 7, 8 months of your pregnancy, it is going through a softening phase. This is all in preparation for birth. During the softening, it can bleed a bit. There's more blood vessels around the cervix. Again, especially after sex, it can be common to have some bleeding. And then a few weeks or even just a few days before you go into labor, it starts to go into the ripening phase of remodeling. There can be some bleeding there as well. Now, with all of that said, if you do experience some bleeding, I'm a big proponent of soothing your fears by going ahead and giving your care provider a call. They will likely ask you questions such as the color of the blood. Is it bright red? Is it darkish brown? How much blood is there? Is there tissue in it? They'll ask you some questions and they might have you come in for a check. But again, remember that having a bit of blood, some women even have some heavy bleeding and are still okay. But again, with all of it, I really recommend just checking in with your care provider. And so now for the aspect of the question of being really afraid to go to the bathroom and having that anxiety come up every time you're sitting on the pot. That's not fun. So something that I started to do after I had my bleeding episode was before I went to the bathroom, I took 5 deep breaths to just calm myself down, to remind myself that, I'm on the exact path to motherhood that I'm supposed to be on, just trusting the process, reminding myself that even if there is blood, again, that's not a definite sign of miscarriage. I can stay calm and just just breathe out the fear. If you do see some blood when you wipe, just go through the process again, take those deep breaths, calm yourself down. Again, take note of the color, the amount, if there's any tissue, and go ahead and give your care provider a call. So I hope this helps you pee with a bit more calm from this point forward. If you have any questions about this or any other questions about pregnancy, childbirth, or early motherhood, go ahead and leave them in the comments below.